If you have high blood pressure, you've probably been told you'll need medication for life. But what if I told you that 3 simple ingredients, beetroot, lemon, and garlic, can lower your blood pressure by 5 to 10 millimeters of mercury through 3 distinct biological mechanisms? A 5 to 10 millimeter reduction in blood pressure might sound modest, but research shows this level of reduction can decrease stroke risk by 40% and heart attack risk by 25%. I'm going to show you the exact studies, explain the precise mechanisms, and give you the specific preparation protocol to maximize blood pressure reduction. Let's start with why this combination is uniquely effective. While doing research on these 3 ingredients and their cardiovascular effects, what makes this combination remarkable is that each ingredient targets blood pressure through different pathways, and when combined, they create synergistic effects more powerful than any single intervention. High blood pressure affects 1.3 billion people worldwide and is the leading risk factor for cardiovascular disease, stroke, and kidney failure. In the United States alone, nearly half of adults have hypertension. The challenge with blood pressure management is that hypertension develops silently over years, damaging your arteries, heart, and kidneys before you notice symptoms. By the time most people are diagnosed, vascular damage has already begun. Let's break down exactly how this 3-ingredient drink works in your body. Beetroot is rich in dietary nitrates, specifically inorganic nitrate compounds that your body converts into nitric oxide through a precise pathway. Here's how this works. When you consume beetroot juice, the nitrates are absorbed in your upper digestive tract. Bacteria on your tongue convert these nitrates into nitrites. These nitrites then enter your bloodstream and are converted into nitric oxide, particularly in areas where oxygen levels are low, which is exactly where you need vasodilation most. Nitric oxide is one of your body's most important signaling molecules for blood pressure control. It diffuses into the smooth muscle cells lining your blood vessels and triggers a cascade that causes these muscles to relax. When vascular smooth muscle relaxes, your blood vessels dilate, reducing the resistance blood faces as it flows through your circulatory system. Lower resistance means lower blood pressure. The evidence for this is substantial. A 2022 meta-analysis published in the Journal of Nutrition examined 16 randomized controlled trials and found that beetroot juice consumption reduced systolic blood pressure by 4 to 5 millimeters of mercury and diastolic pressure by 1 to 2 millimeters of mercury in hypertensive patients. These effects appear within 2 to 3 hours after consumption and can persist for up to 24 hours. A separate 2013 meta-analysis in Hypertension Journal tracked participants over longer periods and found that chronic beetroot supplementation, consuming beetroot juice daily for several weeks, produced sustained blood pressure reductions without tolerance developing. The effective dose in these studies was typically 250 to 500 milliliters of beetroot juice, which provides approximately 300 to 500 milligrams of nitrate. This translates to about 100 to 150 grams of fresh beetroot. Garlic works through mechanisms completely different from beetroot, which is why combining them is so effective. When you crush fresh garlic, an enzyme called alliinase converts alliin into allicin. Allicin is the active component responsible for garlic's cardiovascular effects. It doesn't stay stable for long, which is why the preparation method matters. We'll cover that in just a few seconds. Allicin affects blood pressure through multiple pathways. First, it acts as a natural ACE inhibitor. ACE, angiotensin converting enzyme, is the same target that pharmaceutical ACE inhibitor drugs act on. This enzyme converts angiotensin 1 into angiotensin 2, a powerful vasoconstrictor that raises blood pressure. When ACE is inhibited, less angiotensin 2 is produced, resulting in less vasoconstriction and lower blood pressure. Second, garlic enhances the activity of endothelial nitric oxide synthase, the enzyme that produces nitric oxide in your blood vessel lining. This means garlic not only provides its own blood pressure lowering effect, but also amplifies the nitric oxide pathway that beetroot activates. Third, garlic has significant antioxidant and anti-inflammatory effects in vascular tissue. Chronic inflammation in blood vessel walls contributes to hypertension by impairing normal vasodilation. Garlic compounds reduce inflammatory markers like interleukin-6 and tumor necrosis factor alpha in endothelial cells. The clinical evidence for garlic is impressive. A 2016 meta-analysis in the Journal of Nutrition examined 20 trials and found that garlic supplementation reduced systolic blood pressure by an average of 8 to 10 millimeters of mercury mercury in hypertensive individuals, and diastolic pressure by 5 to 6 millimeters of mercury. The most effective dose was approximately 600 to 900 milligrams of garlic powder daily, which corresponds to roughly 1 to 2 cloves of fresh garlic. Importantly, aged garlic extract, which contains different compounds than fresh garlic, also shows blood pressure benefits, though through slightly different mechanisms. Studies using aged garlic extract found similar magnitude reductions with better tolerability and less odor. Lemon might seem like the weakest component, but it plays a crucial role in this combination by protecting and enhancing the effects of both beetroot and garlic. Lemon provides two key benefits. First, it's rich in vitamin C, a powerful water-soluble antioxidant. Nitric oxide from beetroot is rapidly degraded by reactive oxygen species in your bloodstream. Vitamin C scavenges these reactive oxygen species, extending nitric oxide's half-life and allowing it to exert vasodilatory effects for longer.
Second, lemon contains flavonoids, particularly hesperidin and eriocitrin, that improve endothelial function. Your endothelium is the single-cell layer lining your blood vessels, and it's the master regulator of vascular tone. Healthy endothelium responds to blood flow by releasing nitric oxide. Damaged or dysfunctional endothelium, common in hypertension, loses this ability. Citrus flavonoids improve endothelial function through multiple mechanisms. They activate signaling pathways that enhance nitric oxide synthase activity, reduce oxidative stress in endothelial cells, and improve the structural integrity of blood vessel walls. A 2015 study in the American Journal of Clinical Nutrition found that citrus flavonoid intake was associated with 2 to 3 millimeters of mercury reductions in systolic blood pressure in population studies. While this effect is smaller than beetroot or garlic individually, remember that lemon's primary role is synergistic. It amplifies the effectiveness of the other two ingredients. So beetroot provides the raw material for nitric oxide production through the nitrate-nitrite NO pathway. Garlic enhances both the conversion to nitric oxide and the production of additional nitric oxide through endothelial nitric oxide synthase. Lemon protects that nitric oxide from degradation, extending its duration of action. Simultaneously, garlic's ACE inhibition reduces vasoconstriction from the renin-angiotensin system, a completely separate pathway, and lemon's flavonoids improve the fundamental responsiveness of your blood vessels to all these signals by enhancing endothelial function. This is why you see additive or potentially synergistic effects when combining these ingredients rather than simply adding up their individual contributions. Now that you understand the mechanisms, let's discuss exactly how to prepare this drink for maximum benefit. For optimal blood pressure reduction, here's the specific protocol based on the research. Beetroot: 100 to 150 grams of fresh beetroot, about 1 medium-sized beet. You can use either fresh beetroot or commercially available beetroot juice. If using fresh beetroot, you'll need a juicer or high-powered blender. Wash the beetroot thoroughly, but do not peel it. Many of the beneficial compounds are concentrated in the skin. Cut the beetroot into chunks that fit your juicer. Process immediately to minimize nutrient degradation. Fresh beetroot juice should be consumed within 30 minutes of preparation for maximum nitrate content, though it remains effective for several hours if refrigerated. If you cannot tolerate the strong, earthy taste of beetroot juice, you can cook the beetroot lightly. Steaming for 15 minutes retains about 90% of the nitrate content while making it more palatable. Roasting at high heat above 200 degrees Celsius reduces nitrate content more significantly, so if you roast, keep temperatures moderate and time short. Garlic: 1 to 2 fresh cloves, crushed. The preparation method for garlic is critical. Allicin is not present in intact garlic. It only forms when the garlic is crushed or chopped. Take 1 to 2 medium-sized fresh garlic cloves, peel them, and crush them thoroughly using a garlic press or the flat side of a knife. After crushing, let the garlic sit for 10 minutes before adding it to your drink. This resting period allows the enzyme allinase to fully convert alliin to allicin, maximizing the active compound content. Do not use pre-minced garlic from jars or garlic powder for this purpose. These products have significantly lower allicin content due to processing. If you find raw garlic too intense, you can slightly reduce the amount, but understand that cooked garlic has substantially less cardiovascular activity. Lemon: juice from half a fresh lemon, about 2 tablespoons. Use fresh lemon juice, not bottled lemon juice. Bottled versions have reduced vitamin C content due to oxidation and storage. Roll the lemon on your counter with firm pressure before cutting. This breaks breaks down internal membranes and yields more juice. Cut the lemon in half and juice it using a hand juicer or reamer. You can include a small amount of pulp if you prefer, as it contains additional flavonoids and fiber. Preparation method: juice or blend 100 to 150 grams of fresh beetroot. If blending, strain to remove fiber or keep fiber if you prefer. It doesn't reduce effectiveness but changes texture. Crush 1 to 2 garlic cloves and let it sit for 10 minutes. Juice half a fresh lemon. Combine beetroot juice 250 to 300 milliliters, crushed garlic, and lemon juice in a glass. Stir well. Optional, add 100 to 150 milliliters of water to dilute if the flavor is too strong. Drink immediately or within 30 minutes for maximum benefit. Timing and dosage. For blood pressure reduction, consume this drink once daily, preferably in the morning. The blood pressure lowering effect of beetroot peaks 2 to 3 hours after consumption and lasts up to 24 hours. If you find the taste challenging, you can start with smaller amounts and gradually increase. Some people prefer splitting the dose, half in the morning and half in the evening, though there's no specific research comparing timing strategies. Consistency is more important than perfection. Daily consumption produces the sustained effects seen in research studies. You may see a reduction in blood pressure within 2 to 4 hours after your first drink as the nitric oxide pathway activates. Important safety considerations. If you are taking blood pressure medications, particularly ACE inhibitors or other hypertensive drugs, do not stop or reduce your medication without consulting your physician. This drink can lower blood pressure, and combining it with medications may cause blood pressure to drop too low, a condition called hypotension that can cause dizziness, fainting, and falls. Garlic has mild anticoagulant effects. It reduces blood clotting. If you take blood thinners like warfarin, aspirin, or other anticoagulant medications, discuss garlic consumption with your doctor, as it may increase bleeding risk. Beetroot can cause bituria, red or pink discoloration of urine or stool. This is harmless and indicates you're absorbing the betalain pigments. It does not indicate internal bleeding. This drink is not a replacement for necessary blood pressure medication. It's a complementary approach that works best as part of comprehensive lifestyle management, including sodium reduction, regular physical activity, stress management, and maintaining healthy body weight. Monitoring your response. Invest in a quality home blood pressure monitor. Take readings at the same time daily, ideally in the morning before eating or taking medications, and in the evening before dinner. Record your readings for the first month. A meaningful response would be a reduction of 5 to 10 millimeters of mercury in systolic pressure and 2 to 5 millimeters of mercury in diastolic pressure over 4 to 6 weeks. Individual response varies based on baseline blood pressure, overall health status, dietary patterns, and genetic factors affecting nitric oxide metabolism. Some people are high responders who see greater reductions, while others see more modest changes. Prepare this drink daily using the proper preparation techniques: crushed garlic that's rested for 10 minutes, fresh beetroot juice, and fresh lemon. Monitor your blood pressure regularly to track your individual response.